We are very, very new. We had activities prior to March 2011, but we had our official launch in March. All I can say is when I first found out about CCFIN, I called Greg Zimmett just to see if I could piggyback just a little bit on some of their activities, and now I'm found to be co-chair of CCFIN. And all I can say is Jennifer, her excitement has just launched Indiana. It's unbelievable. Anyway, we had 135 statewide attendees. We were very pleased about that. The state commissioner spoke, the director from Marion County Department of Health, Jennifer attended. We had nonprofit, state, government, pharmaceuticals in attendance, and we had various breakout sessions. This program is a statewide initiative in collaboration with the IU Simon Cancer Center's Office of Health Disparities and Outreach. And what we're doing, again, because we're so new, we're taking an approach to kind of divide some interests and focuses. With my department, we're going to focus more on outreach program development and direction and the cervical cancer screening education. But again, we will definitely be integrating screening and HPV vaccination messaging. Dr. Greg Zimmett at the IU School of Medicine and the IU Simon Cancer Center will focus again on research and evaluation. And what we're hoping also will come out is that we can provide more evidence-based programming to some of our health educators. The Kristen Forbes E Foundation with Kirk Forbes, they'll be focusing more on HPV education, but again, they'll be integrating that with the screening education, and again, policy and fundraising. And also we have a dedicated outreach and development staff, which is Kelly McKinley. Kelly, you can raise your hand. And we're also happy to have Morgan McGill from the Office of Women's Health with the Indiana State Department of Health that will be doing a lot of collaboration with us. Our vision, again, is to raise awareness about HPV and to elimination of cervical cancer through education, prevention, vaccination, and screening initiatives. One of the major things we find important is that we have to focus and address health disparity issues in the state related to the disproportionate rates that cervical cancer affects underserved populations in Indiana. I just want to show you a few maps of the incident rates for Indiana, and you'll see with all races includes Hispanic. Some of the areas that we're going to be focusing on, which is the almost second to the top area, is in Lake County up near Chicago. We'll be doing some activities there, and I'll be talking a little bit about it. Marion County is the light blue area in the center of the state. And to the left is Vigo County, but we'll be doing some programming with the Center of Excellence in Women's Health in Clay County that is right next to that county also. You'll see that mortality rate, again, highest is in the Lake County area, and Marion County also is very high in that arena. African American population, again, African Americans in Lake County, and again in Marion County, and the same with the mortality rate. So I just want to talk about that we will be very data-driven in our approach to addressing health disparity issues. The other thing I wanted to talk about is our Hispanic growth. In the last 10 years, we've had an 82% increase in the Hispanic sector in the state of Indiana, and that's 43% of Indiana's total growth. So we have a huge Hispanic Latino population. 162% of the Hispanic growth is in Marion County. So we will really miss the boat if we do not strategically address these issues with educating Hispanic and Latino sector. Because of the explosive growth, it poses a challenge to the human services delivery system. Adding to the strain is also the language barriers. And we find that 10% of agencies have staff that speak some Spanish. So trying to translate, educate, when a lot of the agencies don't have anyone that's bilingual is very difficult. We'll talk a little bit about what we're doing to address those concerns. Again, we have partners that are very excited about the program. So many are your regular partners, but we're also looking at a non-traditional approach. So you'll see we have the National Center of Women and Excellence in Women's Health, the various Marion County Departments of Health, and different types of cancer-related organizations. At the Office of Health Disparities and Outreach, one of the programs that we're developing and will be starting next month is a one-on-one HPV cervical cancer education and clinical settings approach. We are working with the IU School of Nursing, and I think one of the important things is when you let the community know that you are developing important programming, they also need to know that if you don't have soft money, that the programs will continue. This is one program that we feel can continue because with the School of Nursing, we're working with their fourth-year nursing students that will act as our lay health educators and will go out into these specific areas. And also we will have a bilingual health educator that will be working also. Wishart Health Services is our medically underserved hospital that's on the IU-PUI campus. And they have 9 community clinics, and our health educators will be positioned at these clinics with their patient navigators. What we're really excited about is that we have the opportunity to talk one-on-one with patients that aren't necessarily coming to see a physician because they're worried about screenings, they have something that happened immediately that we're happy they're not going to the emergency center, but also while they're there, we're going to talk about the importance of cervical screening, understanding HPV, and in order to decide what target message that these patients get, we'll do a health assessment. Because gone are the days of when you think that a woman is now past childbearing age, that she doesn't need to know about HPV because now grandmothers are raising their grandchildren, and they need to know also, so these questions will be provided. Some of the other startup activities, Christian Forbes was instrumental in getting CCFA off the ground. They'll also be doing, again, public policy and development initiatives, fundraising, HPV education, and Cervical Cancer Week proclamation also was started. One of our major focuses is working with the Indiana Minority Health Coalition. They have 24 affiliate agencies, and they will be working with us in providing the target messaging to the Lake County area. Indiana Black Expo, I don't know how many are familiar with that, but it's one of the largest black expos in the nation. We'll be working with the Indiana State Department of Health and providing information to over 40,000 people that we estimate coming to the health fair. The other thing is that we'll be providing the survey asking some of the people basic questions that will help us with our development. We're going to also partner with the National Center of Excellence in Women's Health. They have a Clay County project, which they will be providing cervical education, cancer education, and HPV education in a mobile unit that will be staffed by nurse practitioners. And also we're talking with the WNBA, Indiana Fevers, about a program called Every Shot Counts, and this is where we're going to try to spread the word about the importance of HPV vaccinations for 9 to 26-year-olds. Our next steps are to form a strategic planning committee, review evidence-based programming, again, continue periodic review of outcome evaluations, and continue search for funding. And before I do sit down, one of the things I'm really happy about is all of our partners have committed to not only provide the education component, they also will have funding or directives to individuals to get screenings. If they're diagnosed, they'll provide funding or direct patients to maybe Wishart Hospital where they can get the proper diagnosis and the type treatment that they need. Thank you.